Happy day. I'm Dr. Paula Newsome.
And I'm registered nurse Tracy Young.
And together we're the educational faculty for Knockout Diabetes, where K stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching.
So right now I'm going to walk you through some deep breath exercises. And this is very important to take some deep cleansing breaths throughout the day. You may be stressed out, you may have a challenging situation, and you just need to calm down for a moment. And so this is something that you can do anytime throughout the day.
Did you know that you can control your blood pressure by breathing? Did you know that you can de-stress by breathing? You know that you can actually not necessarily engage a lot of endorphins, but you can even change your mood by breathing. That breath is so very powerful. So this is probably one of the most important exercises that we can share with you.
Absolutely. So as we walk through these deep breathing exercises, I want to make sure that you're in a quiet and calm environment. Have a chair that has some back support, maybe arm support if you need it. Your feet should be placed flat on the floor with your legs uncrossed. And also, if you want to relax back in your chair to have your back supported, I'm going to ask you to close your eyes throughout this segment to get yourself ready for the deep breathing exercises. You're going to hear me say inhale and exhale and kind of give you a guide as to how long to hold your breaths and exhale. But I do want you to keep in mind to still do what is within your comfort level, especially if this is your first time going through deep breathing exercises. I want to make sure that you're also breathing in through your nose and exhaling out through your mouth. And as we go through the exercises, I'll make sure to guide you. So let's go ahead and get started. So close your eyes, and here we go. Take a deep breath in, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Inhale, make sure you're inhaling through your nose, and exhale, blowing out that cleansing breath through your mouth. And inhale again, and exhale. Inhale, and exhale. Inhale through your nose, and exhale through your mouth. Inhale and exhale. Make sure you keep your feet flat on the floor. Inhale. And last one, exhale. Wonderful. How do you feel?
Excellent.
Right?
Excellent.
It's such a great exercise that you can practice at any time to kind of help yourself be calm and come down from any kind of stressful day or an event that you're having, or just to kind of clear your mind of any negative thoughts you may be having.
I actually even inhale and exhale even slower. I even just kind of relish that breath. So I even do it at a slower count.
Absolutely.
Because my day is so hectic that I don't want that same speed. I want to
slow
really,
it down.
Yes.
Absolutely. So you can do these exercises at your own pace. It is important to have your exhale be a little bit longer than your inhale to really blow out any of that negative energy or any of that old air that's kind of circulating through your lungs. So thank you so much for watching these breathing exercises.
We want you to be well,
stay healthy,
and stay the course as we knock out diabetes.
Happy day and welcome to our program, Knockout Diabetes. I am registered nurse Tracy Young, and I'm here today to walk you through our weekly exercise regimen and introduce you to our Knockout Diabetes community. One of our program goals is to increase your activity to 150 minutes per week. That breaks down to about 30 minutes a day, and you can get that 30 minutes in each day by breaking that down in 10-minute increments after each meal. By exercising after each meal, that will give you really good effects on helping to lower that blood glucose throughout the day. I do want to give you a couple of reminders before we get started. Make sure that before you start any exercise program, you do consult with your healthcare provider. You want to make sure that you adjust your medication appropriately, as exercising does bring down your blood glucose numbers. You may have any snacks that are needed to combat any hypoglycemia or low blood sugar. You want to make sure that you have a bottle of water or something next to you so that way you can stay hydrated. Some symptoms of hypoglycemia can include shakiness, feeling dizzy, blurred vision, or being excessively thirsty. So please be mindful and pay attention to your body and your body's cues as we go through the video. You can pause this at any time and make sure that you work at your own pace. Let's go ahead and get started. So first we're going to start with our warm-up. It's very important to do a warm-up. That way you can get your body ready for the exercise that we're getting ready to do. And warm-up is going to include exercises that are very low intensity just to get your muscles and your body ready for movement. Our first warm-up exercise is going to be the shoulder squeeze. We're going to squeeze our shoulders to the back and we're going to do 10 reps. Let's get started. Very good. Our next exercise will be exercising our neck. And we used to do the neck roll, but now we're going to take one ear and touch it to the shoulder and do that on the opposite side as well. And then take our chin and put it to our chest and then also move our head to the back. So we'll go ahead and demonstrate that. Let's get started. Again. Again. One more. Excellent. The next warm-up exercise we'll do is arm circles. You're going to have your arms right out to the side of you. We're going to circle 25 seconds in one direction and then 25 seconds in the opposite direction. Let's get started. Forward. And backwards. And arms down. Great job. Make sure that you take time to see how are you feeling. Take a check-in whether or not you need to take a break, hydrate with some water, or continue going. You can pause this video at any time. Our next warm-up exercise is going to be high knees. And for this exercise, you will hold your hands out in front of you and touch your knee to your hand for each repetition. If you are unsteady or you need a little bit of support, you can use a wall next to you or you can use a chair. For this exercise, we will do 20 repetitions. Let's go ahead and get started.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Great job. Our next exercise is going to be side stretches. And for this exercise, we are going to stretch to one side. We're going to do that 5 times and hold each repetition for 5 seconds and then do it again on the opposite side. So we're going to start going this direction first. Let's get started. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Opposite side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Very good. Now that we're finished with our warm-up, we're going to move into our exercise pieces. Our first exercise is going to be the good old sit-up. So we're going to sit on the floor with your feet flat on the floor. And if you need anything to hold your feet down, or if you're working out with someone, you can enlist their help to kind of hold your feet down. And we're going to go ahead and do 3 sets of 10 sit-ups for this exercise. You're going to place your hands behind the bottom of your head, and when you sit up, you're going to push your chin straight up to the ceiling. That way you get really good form. So let's go ahead and get started. All right. Our next exercise is going to be the bicycle. For this, we have the similar position as the sit-up, but we're going to lay flat on our back with our feet at a 90-degree angle as we move our legs as if we are riding a bicycle. We're going to do 2 sets of 30 seconds for these. Let's go ahead and get started. Our next exercise is the plank exercise. This exercise is really going to help with your core muscle and core muscle control. For this exercise, you are going to be on your stomach. You are going to have your elbows nice in front of you, and you're also going to have your feet on your toes behind you. We're going to push up in the plank position and hold this position for 15 seconds, and we will do this 2 times. Let's go ahead and get started. Our next exercise is going to be the bridge, or what we call hip extension. And for this exercise, you will be seated on the ground with your feet flat on the floor. Our backs are also going to be flat on the floor, and we're going to lift our hips up to the ceiling. For this exercise, we're going to do 3 sets and hold them for 10 seconds each. Let's get started. Place your hands flat on the floor and place your feet about hip width apart. And when you're ready, we'll go ahead and lift straight up. So for our next exercise, we are going to do tricep extension. So you'll see that we do have weights here, but I want you to know that this exercise can be done without weights. You can use anything that you have at your home, such as a coffee mug or a can or anything that you have to just give a little bit of weight. And if you don't want to use weight at all, or if you have any kind of restrictions to this, you don't have to use weights, but we are going to use them for the purpose of this video. So with this, what we're going to do is hold this weight in our hands. We're going to place our arms back behind our heads with our elbows pointing straight up to the air, and then we are going to extend. We're going to do this 10 times, and we're going to do it for 3 sets. So let's get started. Our next exercise is going to be the bicep curl. Again, we do have our weights here, but the bicep curl can be done or modified with a can or a coffee mug or anything that you have at your home to give you a little bit of extra weight. This exercise can also be done without any weight at all by simply just moving your arms to get that mobility in your joints. Now, we will be demonstrating single bicep curls, but you can also do a double bicep curl where you hold your can or your weight in your hand and you simply move up and down like this. So there are many ways to modify this exercise but still get the benefit. We are going to do 10 curls on each arm. We're going to start with our right arm first and then move to our left arm. So let's go ahead and get started. Awesome. Switch arms. Very good. Our next exercise is going to be the jumping jack. We're going to do 3 sets of 10. Let's go ahead and get started. Ready? Go. Now it's time to cool down, and this is a very important part of any exercise as it helps your body recover from the exercises that we did previously or in any workout that you participate in. So now we're going to start with the abdominal stretch. For this stretch, you are going to have your hands flat on the floor, your elbows about shoulder width apart, and we're going to push up to stretch our abdominal cavity. And what we're going to do is stretch for about 10 seconds and do this 3 times. Let's go ahead and get started. Okay? Now. And again. Our next cool down stretch is going to be the sit and reach. So for this, you're going to sit on the floor with your feet straight out in front of you and try to pull your feet back to your knees so they're kind of at a 90-degree angle or a little bit more, so you feel that stretch right in the back of your legs. We're then going to reach to touch our toes, and we're going to hold this stretch for 10 seconds, and we're going to do it 3 times. Ready? And relax. And again. And relax. And again. And relax. For our final cool down activity, we're going to breathe in for a count of 8 and breathe out for a count of 8. For this activity, you will sit on the floor, and if you can, cross your legs or just in any kind of comfortable position that suits you. We are going to breathe in, and we're going to raise our arms above our head, and then we will count to 8, and then we will breathe out and bring our arms down for another count of 8, and we'll repeat this 3 times. Let's go ahead and get started. Go. Breathe in. And breathe out. Breathe in. And breathe out. Breathe in. And breathe out. Awesome job completing this workout with Knockout Diabetes. As always, we want you to
be well,
stay healthy,
and stay the course as we
knock out diabetes.
Happy day. I am Dr. Paula Newsome.
And I am registered nurse Tracy Young.
And together we are the educational faculty for Knock Out Diabetes, where KNOC stands for knowledge, N stands for nutrition, O stands for ocular health, and C stands for coaching. And today we are going to be talking about something that nobody really likes to talk about, but it affects anywhere from 40 to 80% of people with diabetes or any chronic condition, and that is the depression. And I'm going to call it the depression spectrum.
Okay.
Because it's not just depression.
Right.
Sometimes it's anxiety. And so depression and anxiety, we actually have a tool that we use in the program that will assess the amount or where you are on that continuum, depression versus anxiety. We're also going to talk about some coping strategies today. And then you also need to be aware, and you guys need to be aware, that cortisol causes blood sugar to go up. Now, why do I mention cortisol? I'm sure you all have seen TV commercials about hydrocortisone. Cortisol is a hormone that the body makes that causes your stress. It comes out when you are stressed, but it also causes your blood sugar to go up. So if you're not eating, but you're really concerned or worried about something and your blood sugar is going up, it's primarily because your cortisol levels are increased.
Yes.
So
they go hand in hand.
All the time. So again, there's anxiety and then there is depression. And do you want to talk a little bit about anxiety?
Anxiety can feel different in everyone. And it's just a response that you can have. You might be having nightmares. You might just feel worried all the time. It could be a form of panic attacks or headaches. It can also be come on by memories that you feel like you can't control.
Right. Well, I'm going to give you an example of a panic attack. As you know, I walk very early in the morning.
Daily.
And so I was out and I was getting ready to walk a particular path, and I saw a guy coming on a bicycle in the opposite direction, and he was going in one direction. So I purposely went another way. And the next thing I know, I hear him coming behind me on his bicycle, and I went into a panic. And I started running, and I have not run like that. It was so funny. I was like, oh my God, this man is going to attack me. He may not have even been paying me.
We weren't thinking about you. We weren't thinking about you.
But in my mind, he was going to attack
That's
me.
right. That's
and
right.
So that's all that matters.
That's all that matters.
That's all that matters. And that's how panic attacks can be.
Yes.
Another example is both of my parents died, and they died within a short amount of time of each other.
Right.
And I'm an only child.
Yes.
And so while I never would admit it, I know I was having memories about things that we did together, or ways that I could have helped supported my parents as they were going through their final days. And I didn't even know they were their final days because I was still so hopeful that they were still going to hang in there and that there was going to be a different outcome. But there wasn't. And then in having to deal with the aftermath of that was very, very painful.
Absolutely.
It was very painful.
I'm so sorry.
So also in anxiety, you can have an increased heart rate. You can have rapid breathing.
That's right.
You can have difficulty going to sleep. And that's a big one. Yeah, it's a big one. And then you can have trouble concentrating.
Yes.
And then, like I said, you can have trouble, not only difficulty going to sleep, but you can also have difficulty staying asleep.
Right.
And so we know that it's best for us to have 7 to 9 hours of sleep per night.
Your body needs that time to rest.
Absolutely. But not only does it rest, it also rejuvenates and it re-ups and it replenishes itself. And so when you don't get that rest, it's very, very difficult for you to operate maximally the next day.
Yes.
Your fuse is a lot shorter. Things that may not necessarily bother you may bother you more so. Yeah.
Absolutely.
Yeah. So, would you like to share some strategies?
Sure. So to manage your anxiety and manage stress, make sure that you're getting enough sleep. So that 7 to 9 hours, it's very important to make sure that you get enough sleep.
Do you do tea ever before you go to sleep?
Sometimes. I actually am blessed that I sleep. So I do have others in my family that I recommend teas for them to kind of help with their nightly process of kind of getting ready to go to bed, getting that ritual together, you know, stop eating at a certain time, and instead of having a nightcap of alcohol, because that is something that can keep you up, but having a tea or something that's more relaxing.
And I think it's really important for folks to understand that we're not talking about a caffeinated tea.
Right.
It has to be an herbal. And so it has to be something that will allow you to go to sleep.
Right.
Because caffeine will not allow you to go to
keep
sleep
you up
under most circumstances. I know some people who can sleep with caffeine in their systems. I am not one of them.
Right.
But yes.
In addition to...
Can I just say one other thing? You mentioned something again that was very, very important and that I want us to really hone in on, and that is the plan. So you mentioned that you share with some of your family members a plan for making sure they have a ritual before they go to bed. Can you just elaborate on that again? Because I think we need to just spend a little time here. Most people just take a bath and go to bed.
Go to bed, right.
Or they may just go to bed.
Right.
Hopefully they brush their teeth.
At least.
But you never know.
Hey, it is what it is. No judgment here. So the ritual is really important because as humans, we need routines and schedules. And so establishing a time that you're going to shut down, kind of get your household quiet, whatever that looks like for you, and then making sure that your mind is kind of anticipating and understanding your routine. And so it's starting to shut down. And so having that ritual kind of gets you ready, you know, saying, okay, I'm going to cut off the TV or take my time away from the smartphones and kind of allow your brain to start to shut down and get you ready for that restful sleep.
You mentioned smartphones, and I apologize for being occupationally oriented, but
that's what it's all about.
But really, you need to shut down from all screens at least one, just like you need to stop eating. You need to shut down from screens at least 1 to 2 hours before you go to sleep. Why? Because smartphones or any kind of screen depletes the body of melatonin and serotonin. And those are neurochemicals that you need for good, sound, restful sleep.
Absolutely.
So you absolutely need to shut down those devices at least an hour before sleep.
Yeah, and your brain is looking for that activity. It needs a dark room. You know, you should be sleeping with, you know, if you have a night light or a bathroom light or something that's on, your brain is kind of looking for those signals. And so sleeping in an environment that is dark will really help your brain go to sleep.
What about the TV on?
No TV.
Okay.
I know some people say it helps them sleep. I personally don't have that belief. I think if you do need some kind of, you know, some people say like a ceiling fan or, you know, just to hear something in the back. Yeah, some white noise, right. So I would, you know, recommend using some kind of speaker, or if you have to have your TV on, YouTube has a lot of videos that you can use a blackout screen and it still plays rain in the background. You know, if you're someone that, if it's way too quiet, it's like you can't sleep, you need a little something. But falling asleep with that TV on, with the flashing lights and things like that, your brain is like, wait a minute, there's something going on here.
I'm missing something. I need to wake up. I need to engage.
That's right.
Yes.
That's right. And so that's about sleep. And we could go on and on about sleep. But another good thing to help manage your anxiety and your stress levels is meditation. Some people call this, they could call it prayer, they could call it your downtime, but meditation is really a intentional way of calming your mind. So it can be deep breathing, it can be affirmations, it can just be a simple prayer that you say to yourself, but it is a way for you to kind of connect your mind and your spirit and your body together, and that can really help bring down some of your anxiety. Also staying active. And staying active helps with your sleep as well, right? So if you're staying active throughout the day, your body is ready to shut down at night. So being active is definitely something. It can be an outlet as well. If you have any anxiety, or you're angry about something, or you're having negative emotions, staying active can really help with those.
One of the things that happens when I go out in the morning at 5 o'clock or 4:30.
Way too early for me.
But it works for me.
Yes.
I'm out there and I'm meditating and I'm praying. But in addition, endorphins are being released. And I mean, it is so hard for me to get up out of the bed, especially when it's like 20-some degrees outside. But after I layer and I go outside and I get outside for about, it doesn't even take a full minute. After I get outside and I start breathing the air and just the breath, the intentional in and out of the breath.
That's right.
Plus just, being thankful that I'm alive and
gratitude.
All of that. By the time I hit the corner,
you're good.
I am so good. Those endorphins are kicking in. I'm like,
I can just imagine you out there getting
climb the next mountain.
Getting started is the hardest part. It is. It truly is. And I feel that way when I actually can make it to my elliptical and I get on there. Same effect. It's just not after, but like you said, a minute, 30 seconds. I'm like, okay, I'm here.
But it's
I'm
just
ready.
Getting there.
Yeah, getting there.
And there will be tons and tons of barriers that will present that will try to keep you from getting to your happy place.
That's right.
Your happy place and your happy space.
And that's it.
So make sure that you stay the course.
Absolutely. So just staying the course of managing our anxiety and depression, there are some strategies that we can use. And so like limiting alcohol consumption. I know sometimes it's easy to say, well, I need a drink, or I need, and really, alcohol is a depressant, and so it's going to bring you down. It's going to bring you down even more, and so it's kind of breaking those. It's breaking those myths, I guess, that we have about how to manage things, and getting better strategies. And so, limiting alcohol consumption is one of those.
You also want to limit your caffeine consumption, and I talked about that with the teas. So you want to make sure that you're using an herbal tea. It doesn't really matter. They say catnip, they say peppermint. I like peppermint, but I know people that go to sleep with just water and lemon. So the important thing is limit your caffeine consumption.
That's right. And also quit smoking. If you smoke, you want to quit smoking, and I don't like to really say even limit smoking, because it is raising blood pressure and all other kinds of things that are adding to not helping you manage your anxiety.
My mother died from lung cancer, so smoking is just one of those bandwagons that I'm totally on, and I have zero tolerance for smoking. It's just not positive or affirmative in any way. And then to watch somebody go through that process, it's very
it's unnerving.
It's emotionally draining.
Yeah, agreed. And then positive affirmations. And so this kind of goes along with our meditation, and we will do a little bit more positive affirmations and meditation and deep breathing, but those positive affirmations are a way of speaking to yourself. I am enough. I am beautiful. I am healthy. I am positive.
I manage my diabetes. I exercise on a regular basis. I am successful. I am at my ideal body weight. And if I'm not, I'm closer to it this week than I was last week.
Exactly.
So, and you know what? It's also a good idea to take those positive affirmations and write them down and tape them up. I used to have positive affirmations on the mirror in the morning
Sticky
in the
notes.
bathroom.
Yeah.
And I would sit there and I'd read these, and I could tell you what they are, but I won't.
That's right. Make up your own.
Yeah, make up your own.
What
It's very
works for you.
personal.
Yes.
Because, you could have some stuff that you're dealing with from your childhood.
You get it out.
Just get it out. Get it on paper. But then just say those affirmations. And it's not enough just to say them silently. Every now and then, say them aloud. Say them with power.
That's
Say
right.
them with purpose.
That's right. Absolutely. Okay. You want to talk a little bit about food?
Absolutely.
And how that can help?
Absolutely. So there are foods that are de-stressors, and they're primarily de-stressors because they're antioxidants and they're anti-inflammatory. And one of the ones that I absolutely love is salmon. I love salmon. Salmon is so wonderful. Again, I do not buy farm raised, I buy wild caught. It's a little bit more expensive. The taste is undeniable. There's just such a big difference. And I can give you a very good recipe for it.
Okay.
If anybody wants it,
They want
you
it.
can reach out. But extra virgin olive oil, both sides, Canadian steak seasoning, both sides very lightly though, and Old Bay seasoning, cover it in the oven, 20 to 20 minutes or so at 350. Oh my God.
Delicious.
One of my friends told me I saved her marriage. So she said her husband said, "I am not leaving you. This salmon is good."
That's
So,
right.
for real. And then there's also chamomile, which is
one.
also
A tea.
It's in a tea, but it's also you can. The tea is probably the more common form of it, and it works. But there's also turmeric, and they even make a turmeric salt now.
They do.
They do.
Okay.
They do. I actually have it. It has a little bit too much sodium for me, but turmeric is wonderful because
is.
again, it's an antioxidant. It's an anti-inflammatory. You can even sprinkle it on popcorn.
You can. You can put it
Yes.
on a lot of things, and
Yes.
it just gives it a little bit of flavor, and it's giving your body all those benefits. I put it in everything.
Absolutely. Also, there's peppermint tea, which I love. There is green tea, but green tea does have caffeine, so I would say do green tea earlier in the day.
Correct.
Green tea is also really good for weight management and also for anti-inflammatory properties. Yogurt is fabulous,
It is.
and we'll talk a little bit more about that. And so is dark chocolate, primarily because of the resveratrol in the dark chocolate. And that's also an anti-inflammatory.
Absolutely.
The yogurt primarily for the probiotics, and so Hippocrates said a long time ago that all disease starts in the gut, and yogurt is a really good food to eat if you watch the label.
Right.
Because if you eat the processed yogurt, not as
You're
good
not going to get those benefits.
as the natural yogurt.
Absolutely.
And adding your own fruits.
Absolutely.
Yes.
Right. Not the pre-mixed kind, the
That's really high in sugar.
Right. Absolutely.
Okay. So there is a survey that we can send to you. If you will contact us, we will make sure we get that to
Absolutely.
folks.
It's very good to just judge where are you on the anxiety continuum. It's you have to be very honest with your answers and your choices, and get your score of
Right.
what are you do you not have any anxiety at all, or is it a severe anxiety that you're having?
So it grades it severe, moderate, mild, and none. So depression is a little different. It's more of a biochemical reaction. It also can be genetically linked. It's associated with personality, and it can also be impacted by environmental factors.
Absolutely. So some of the symptoms of depression, you can just feel an overall sadness. You can feel like you're out of control, or that you've had the loss of interest in doing things that you used to love to do. And not just a time constraint, I don't have time to do it. You just don't have that interest, it doesn't bring you joy anymore.
So for instance, somebody who used to love to garden, then all of a sudden didn't garden, and when you talk to them, it wasn't because there was some pollutant in the air.
Right.
It was just because they didn't know why. You really need to check, because that's a real big tip-off that something is amiss.
Yeah.
So just make sure, not just for you, but also in your family members, that if there's a loss of interest in something that they were previously doing and they're no longer interested in, try to dig a little deeper and see what's going on there.
Why is that? Absolutely. And kind of to piggyback on that, just withdrawing. So someone who, maybe just now is not coming out of the house as much, they don't want to participate in activities, if that was something that they would normally do. So we're looking for any kind of deviation from their normal personalities, their normal activities. And you can assess that in yourself, and you can assess that in a loved one or in your family. And then also just a feeling of kind of self-loathing, just being down on yourself. I can't get this right. Nothing's working for me. And if you're experiencing these symptoms, not just for a couple of days, maybe something really detrimental did happen, and you're just sad. All people just get sad. But if you're, having these for over a week, 2 weeks, 3 weeks, a month, that is definitely when you're getting into, I need to talk to someone about this, or I need to recommend my family member to talk more in depth about what's going on.
Yeah. All of those are big signs. Also, sleep difficulties, and that could be too much sleep or too little.
Absolutely.
There's some people who don't sleep a lot. I guess I'm on that list. Don't talk about me too bad.
I'm sorry. Well, I can sleep a lot, so don't talk about me either. But too much sleep or too little sleep, you want to be in that balance.
Right.
Absolutely. And that can cause you to have a loss of energy. Maybe you're getting sleep and you just feel like, I still feel tired, like I'm sleeping, but I'm not getting restful sleep. It goes along with that restlessness with, anxiety. So that can definitely be a symptom of depression, or you're not able to sleep at all. You're tired, but you can't sleep, for whatever reason.
Feeling guilty is also another one. That is one we use a lot in this society. I mean, we guilt each other.
We do.
And it is just, it's so wrong.
And
So
unnecessary.
it really
it's unnecessary.
is.
Stop judging people.
Yeah, stop it. Stop it.
Absolutely.
But the big one is thinking about death or suicide. And I've literally had team members who've said they wanted to kill themselves. And I'm like,
we don't play around with that.
Whoa. Whenever I hear that, I don't care who it is. That to me is a cry for help. And so you've got to be really, really alert. If this is you, you really need to seek help immediately. So there are several tests and assessments for assessing where people are in terms of depression and whether or not they have depression. We've given you some of the things, but I'm sure we have all had situations where it looked like we were not going to make it out. And one of the things that we would like to encourage you to do is to think about a time when your back was up against the wall, you were feeling really, really bad, and you overcame whatever it was. Maybe it was you couldn't pay your rent, you were feeling really guilty, you couldn't sleep about it, and all of a sudden, something happened. You were able to pay your rent, and you were able to move on. Or think about another situation where it just looked like just everything was collapsing all around you.
Right.
And you overcame. What is it? Because we know, depending on how old you are, even if you're 14, we know that there are situations that you can think about.
Absolutely.
Where you overcame. And so we encourage you to start thinking about that, but not so much about what you did, but what were the strategies you used to overcome.
Absolutely. Absolutely.
So maybe you needed some money, you didn't have any, and you didn't know where you were going to get it from. What did you do?
Right.
How did you engage resources? Did you increase your hours at work?
Absolutely.
Did you take on a second job?
And it's really, what will also make this easier to go back and recount those things. When we're talking about journaling, when you're feeling down, when you're not, kind of feeling yourself, or maybe you're feeling really great. Whether you're journaling daily, weekly, or monthly, it's a way to go back and recount, how was I feeling while I was going through this? What was happening in the moment?
Some other things that they should write down. What was the weather like? What had you eaten before you started feeling like you started feeling? What were you doing? All of those things kind of play into it, because there are some foods that can take you up, but they can also take you down. And so you want to keep track of that, because they're very subtle things that are going on. So when you're journaling, make sure you not only, the who, what, when, where, why, and how. You want to make sure you capture all of those things in that process.
Absolutely.
Because it'll be very revealing, and you may even notice some patterns that exist.
Identifying patterns will definitely help with anxiety and depression, and also managing your diabetes, because it all goes together. For some that have just been diagnosed with diabetes, or are in the pre-diabetes stage, or you've had it for a while and maybe have suffered, an amputation or something like that, it can be a very halting moment in your life to be diagnosed. So
I agree. I saw someone yesterday who just said she doesn't call it diabetes, she calls it the D word. And I said, okay, whatever you need to do to cope, but you have it.
Yes.
And let's talk about strategies to make that work. One of the things that really is impactful is, do you understand how the medications work? And how can you be a better steward of taking those medications? And then how do you feel about taking them? And, what's the plan for making sure you incorporate that in your daily routine?
That's right.
It's so important.
And so back to just our 10 for 10 pledge with this program, we do want to make sure that, we stay mindful with what's going on, and how to really stay engaged in the program. So making sure that every day you are checking your vision daily with your tool.
Also, that you're monitoring your food intake daily, and that you're monitoring your blood glucose daily, and that you're keeping up with your program materials.
And you want to make sure that while you're writing in your journal, that you're writing when you feel out of control, when you feel good, and being open to changing behavior, or any change in behavior.
Right. And don't forget about the who, where, what, when, why, and how when you're doing your journaling. That may give you some clues as to what may be tipping you off in the out of control moments versus the in control moments.
Absolutely.
Also be open to change behavior. Again, remember, change is a continuum. There are going to be some things that you're going to be very excited to change, and then there are going to be other things that are going to require some nudging. Check your feet daily. If you have difficulty getting down because of back issues or physical issues of checking your feet daily, get a mirror that you can keep on the floor, and then again, just make sure you check those feet daily.
Absolutely. 150 minutes of exercise per week. That's 30 minutes a day, or 10 minutes 3 times a day.
And also just know that 150 is great for maintenance, but if you really want to lose weight,
Right.
it's 240.
That's right.
So 150 will keep you right where you are, but if we're trying to get to our ideal body weight,
That's
we
right.
want to get to 240 minutes.
Absolutely. And make sure that you attend at least 80%
Right.
of our classes and get the information that you need. If you miss a class or you miss a video, go back and make sure that you're really picking up and rewatching and getting that information, and fully participate in Knockout Diabetes and all of our activities.
Absolutely. We want you to be well,
Stay healthy.
and we want you to stay the course as we knock out diabetes.